there's quite a lot of skepticism in cell therapy, and I see that, and I see even some of the valuations of cell therapy companies are like trading half the cash or something. It's like pretty crazy. What do you think of that skepticism?
Well, it matters so much whether you get it right. This is true for every type of drug, right? But for cell therapy, you have relatively high cost of goods, right? And so you have to, as I mentioned, give something back in return that is so mind-blowing for physicians, patients, for payers. The existence of cell therapy and the application is justified, right? And so what patients love in cell therapy is that this is one and done. I mean, imagine you're like 200 miles from a large academic centers. You don't want to go back there like every third week, or like in the case of Imtax, every week, which is pretty tedious. So they love the one and done, the single application, although it's a tedious application, right? But then it's also
to stay close to the center also for
exactly, right?
but it's one same.
And the other part is obviously the efficacy, right? And what's something that's, I think, been underemphasized is deep responses. So a lot of these biologics that are being developed exert a good amount of tumor control, which can then actually translate into nice survival benefit. But actually shrinking tumors really matters. I mean, our patients are coming in with more than 100 millimeters of sum of target lesions. So that's the kind of total diameter, and that's just the target lesions that are measured by the urologist. If you add the non-target lesions, some of our patients have 200, 300 millimeters. So this is like a grapefruit and up to, in some extreme cases, a basketball of a tumor. Those large tumors really have a significant impact on quality of life. These patients and their physicians are seeking drugs that are dramatically shrinking tumors. And that's something that cell therapy is particularly good at. And it acts very fast. We've seen some of these very large tumors shrink within a few weeks, substantially, and then deepening over time and over months and even beyond a year and longer, and giving a kind of substantial relief to these patients. We recently had a mucosal melanoma patient with a large tumor in the face, sitting basically in the nose, and sort of saw a near to complete response. And this patient now can exercise again, can work again, can actually smell again, and thinks this is a miracle. And to some extent it is, right? And so physician and patient are enthusiastic about the impact on quality of life, and that needs to be added. This is where cell therapy offers something unique. So cell therapies that are as powerful as CD19 and BCMA CAR T therapies, or as our PRAME therapies, these deep lasting responses that really make this tumor shrink so substantially that it has a meaningful impact on the quality of life.